Good morning, everyone. Welcome to Families Together, New York State's 4th out of 6 Family Empowerment Month town halls. This is the 4th one, and the others that have happened already are on our website and can be viewed at any time. Today's is being recorded as well. And then we have 2 next week, the education one and the developmental disabilities one. Additionally, we have the Families Together Empowerment Day on March 21st in person for the first time since 2020. So we're excited to see everyone and to be able to further our agenda here in Albany at the Legislative Office Building. Today, I'm really pleased to be able to introduce our panelists who are here to listen and answer questions from people with lived experience who are our ambassadors on the call. So our 3 panelists, I'll introduce each of them and let you each have a chance to just say hello and briefly tell why you're here and who you are. So our Deputy Commissioner from OCFS, Lisa Ghartey Ogundimu, you want to introduce yourself?
Good morning, everyone. Lisa Ghartey Ogundimu, Deputy Commissioner for Child Welfare at the New York State Office of Children and Family Services. I am here as a participant. I'm here to listen, to learn. We are in the space of transforming child welfare to make sure that we are doing the very best to improve outcomes for the children and families we serve across the state of New York. I am very excited to be here and to have on the panel my new colleagues working as part of our team, Daphne Brown. We have Jessica Cooper and Nancy Fortunato, who are our family policy advisors at the New York State Office of Children and Family Services. Thank you very much for allowing me to be here.
Thank you, Lisa. Senator Brisport.
Hey everyone, New York State Senator Jabari Brisport, Chair of Committee on Children and Families. Pleasure to be here, looking forward.
Thanks. And Assemblyman Hevesi.
Hi, thanks, Paige. I'm Andy Hevesi, member of the Assembly for 18 years and also chair of the Children and Families Committee.
And before I turn it over to Daphne, I just want to say this is one of my favorite ones because we have such strong relationships with the chairs in both the Assembly and the Senate and with the administration, with the Deputy Commissioner and with commissioners over the years at OCFS. We are so thrilled that in a system that is not always viewed as family friendly, that we have been greeted and treated as partners and allies. And we can view all 3 of you as allies. So thanks again for being here. I'm happy to introduce Daphne Brown, who's the Deputy Director at Families Together New York State. Daphne?
Thank you, Paige. Good morning, everyone, and thank you for joining us as we have this discussion about how New York State is moving towards the mission of providing safety, permanency, and well-being for families across New York State. With that being said, I'd like to cue up Jonathan so that he can ask his first question to the panelists.
Thank you, Daphne. Hi, everyone. My name is Jonathan De Jesus. I am a foster youth who now advocates for the young people. I'm currently employed by You Gotta Believe. We're an agency that just helps find people permanency, especially focusing on all the youth as well. And we believe that nobody should age out of the system without permanency and just family as well. I'm also serve as a co-chair of the Foster Youth Action Committee with Families Together. And over the past year, I just really had the opportunity to serve on the Youth Advisory Panel to participate in the research project that was focused on foster youth experiences in institutionalized settings, also known as congregate care. We surveyed over 100 youth who had lived experiences during these facilities and during their time in foster care, and were able to document their own account of the places through the surveys and interviews. We were able to take all of this information together through surveys and interview, and from the children's rights and the community impact advisors, we developed findings and a lot of recommendations into this report called Are You Listening? And it's just a youth account of congregate care placement in New York State. A lot of our findings this is how young people really experience institutions. A carceral environment, including severe limitations on privacy, just bathroom use, poor food quality, and just being able to the limits of access to their medical care, the threats to the safety, such as some severe punishments that they do have within there, feeling unsafe and in danger by staff or the youth, and just living in an environment that is full of violence and bullying. We also found that there's a lot of loneliness stemming from just facing some restrictions, whether that is the communication and just visits from families and friends as well, and just being able to feel disconnected from their relationships and experiencing apathy from staff. And a lot of this disconnection from relationships, just being able to be distanced away from their families throughout their stay in foster care really brings a very big gap between their family relationships that they do have built and then after they go into foster care. And another one that we have is just being able to lessen barriers to the well-being and the stability, especially the youth that are living, that they do leave the foster care system. A lot of them feel hopeless, traumatized, and just not equipped to be able to pursue their education, career, and just kind of independent, unprepared to go into independent living. After we review all of these findings and some of the recommendations that we had were partnerships with lived experience, practices and policies that will lead us to elimination from foster care settings and just ban the use of restraints and other punitive practice. Also, just having the preservation to support for families, being able to increase a lot of community resources to help families be able to stay together in the first place so that they don't have to experience this gap of separation between their relationships and just bonding that they have with their families. I think we also been able to increase the transparency and just hold accountability around congregate practices and whether that's making a facility data publicly available, independently being able to just evaluate the staff conduct and just ensuring the process for youth to share the maltreatment concerns occurring in a foster congregate care setting, just creating that space for them as well. And with that, on behalf of the young people who help with the report and the thousands of young people that are currently in the system as well, I would like to ask you all, are you listening? And what is the New York State at this moment doing to end the institutionalized foster care in the system right now?
So why don't I start and then others should feel free to jump in. I would say, yes, we are listening. We have heard you loud and clear, and not only your voice, but our data is driving us towards the transformation that you speak of. We have in New York State implemented the elements of Family First, standing up the requirement that we have qualified individuals assess youth before placement in a congregate care setting. We have a number of licensed psychologists who are conducting these assessments to make sure that a placement in a residential setting really is necessary. We feel that that's the highest level of care, and that should not be where youth go in the first instance. So that's step one. We are also partnering at the state level with the Bravehearts. That is a youth-led organization that was created by youth who have been in the foster care system and some who are currently in foster care. We are going to stand up, and this is the name that they've created, a heartline, a support line for youth in care, which is an ability to call OCFS directly to share your experiences. We're seeing this not only as a service for youth in care, but also an employment opportunity. We are going to have members of Bravehearts will be conducting the interviews, hiring the teams that will be responding to the calls as our intake workers. And we see this as a pathway to greater employment as well. So that's going to be a direct avenue for support for kids to call us directly about what they're experiencing. We are also increasing the number at OCFS of our oversight workers to make sure that they're conducting more interviews of youth in residential care, but also more on-site visits for kids in foster boarding homes. We agree that, and also just want to say, we're also developing a youth bill of rights to make sure that every youth has a copy and understands their rights. Not only that the youth have it, the residential providers have it, foster parents have it, and most importantly, biological parents have it. For us, foster care is a short-term intervention. Kids only need to come into care if that is absolutely what's needed. First and foremost, it's space for parents to get the supports they need, children, if there is a need for therapeutic supports, and then they are getting what they need. And the goal is always reunification for the family to come back together. That has not been, our data is showing that too many kids are aging out of care. So there's a lot of work that we have to do. And we believe that the steps that I've mentioned are going to improve our service provision for kids in care. And also make sure that families are getting what they need. We are partnering with Department of Health to make sure that Medicaid services will help youth while they're in care, and also services for parents as well. So that when kids are ready to transition back home, mom, dad, siblings have also been receiving therapeutic services. We've addressed those underlying factors that have driven children to our attention so that the transition home can be much smoother. So this is a multi-year effort, but it's in response to many of the things that we've heard that you've just stated right now as well.
And I would just also add to one, thank you for your question, Jonathan, and I really appreciate you sharing your story. And, recognizing that really no one should be in congregate care, that everyone should be in a family unit that is stable and loving, whether that's biological or chosen, doing everything we can upstream to prevent, people from having to enter the foster care system in the first place, upstream investments, diving deeper into the state reimbursing at higher rates for preventative services and for child welfare. It's been something that's been eroded over several decades, originally, being codified at 75% reimbursement, and then shifting down to 65, and then the state not even meeting its obligation to meet 65 and paying only 62%. But when we do adequately fund these services, it drastically reduces the number of youth living in foster care. I think I've seen statistics of upwards of 46% decline in youth engaged in foster care through these preventative services, and making sure that families can be stable and whole. And then I just want to also offer another thing that the Assembly member and I are working on, which is for youth that are aging out of foster care, making sure they have the supports, especially on subsidies for basic cost of living things, rent subsidies, increasing the amount of money to help youth aging out of foster care pay their rent.
Assemblyman Hevesi, would you like to answer?
I would, but they stole all the good stuff, so it's going to be very hard to do. So thank you to the Deputy Commissioner. I think she answered that question wonderfully, and also to Senator Brisport. He's absolutely right. So the state has fallen down on the job over the last couple of years, particularly with prevention services. So getting the reimbursement rate to counties up to where the law requires it to be, to 65-35, and if we can get up to 75-25, where the program originally started, that would be fantastic. And then let me just elaborate on, the senator hit on it, but there's something that's paid out of that fund called the Child Welfare Housing Subsidy. That subsidy was created in 1988, I believe, with the goal of doing a couple things. One, preventing kids from getting into foster care. So if there is a circumstance where you find a family and the only reason why that family would not be together and the child goes to foster care is the amount of the rent subsidy, they created this child welfare housing subsidy for that population. And that subsidy can also be used for youth that are already in congregate care to get them out. So we understand the difficulty of families going through this, and children as well. But the problem is we have been in state government, as the senator mentioned, hamstrung by governors in the past who were short-sighted and wouldn't allow us to raise, particularly that child welfare housing subsidy had stayed at the level of $300 for over a decade. Now, we fought to try to get it increased over the last decade, but we're told no. by the last governor. The one thing we were able to do is allow that subsidy, the child welfare housing subsidy, to have roommates. So kids who can use it with other children who are in the same circumstance. So we're able to get that, but we haven't been able to raise the rates. So this year, I believe we'll making aggressive steps towards building that subsidy back up to where it needs to be, to $725 for those kids. And as the senator said, we're going to be pushing for a variety of other things because we agree with you. The shorter that we can have kids in foster care, the better off we're going to be. So I thank you for the question.
Thank you.
Sure.
So I'm going to ask the next question. Again, I'm Daphne. I'm a parent that has been impacted by the child welfare system. And also I'm currently raising my grandson. So one of the biggest determining factors for whether a family will experience a CPS investigation or the foster care system is poverty and race. This often comes down to a specific zip code. The families that come to our family peer support programs are often struggling to access basic human necessities like food, shelter, childcare, adequate income, and housing. If poverty is a root cause of child abuse and neglect, what opportunities do you see in this year's budget to fight poverty and not families that are economically disadvantaged? And my question is, I'm going to ask Senator Brisport to go first.
Yes, thank you, Daphne. I would say there's a very holistic picture of things that the state government could be doing to make life easier for working parents, working class parents, and working class families. Most directly ones being, just maintaining and even expanding the child tax credit to protect working families and making sure that they have the resources they need. But there are a suite of things to do to help out with the cost of living crisis for working class families that ultimately, trickles down into them having struggles maintaining the families that they want to, whether that be doing things like tenant protections, like good cause eviction to address skyrocketing rents, campaigns to avoid fare hikes on public transit. This Assemblyman I've been working very hard on decreasing child care costs and working towards a universal child care system. All these costs add up for working class parents and make it harder for them to live. So supports in terms of controlling the costs that you're facing, but also putting more money into working class families' pockets through things like the child tax credit.
Thank you. Lisa or Assemblyman Hevesi?
Commissioner, do you want to go first? Feel free.
Okay, I'll jump in.
Your call.
I will jump in. I think that's not only a great question, it's what has been driving us within child welfare. And I often speak about a data point that is central to all of us. That 57% of the families that come to the attention of child welfare, where there's an actual indicated case, the case is indicated for poverty alone related matters, not serious abuse or neglect. Knowing that data point has been a important driver for us as we look at the strategies that we implement. And mention was made earlier about upstream prevention, and we absolutely agree. And we can talk about the percentages, but I think everybody would agree that New York State has always had a rich footprint in the space around prevention. And for me, it's making sure that prevention itself is doing exactly what it's designed to do, prevent families from unnecessarily experiencing this extreme intervention known as Child Protective Services. So what are we doing to address that? We are implementing strategies that are really designed to address the connection, that intersection of poverty and child welfare. We are really excited, very close to launching our direct cash transfer pilot, the first in the nation that is really targeting money as an intervention to prevent the deeper entry into child welfare. So this is a pilot with 3 counties, Westchester, Monroe, and Onondaga. It's a randomized control study. We're working with the University of Pennsylvania, 150 families. Once that come to the attention of child welfare will be receiving $500 a month for a year. We are going to study them, and our goal at the end of it is to advocate at the state and the federal level for money to be seen as the intervention that sometimes families just need help. They don't need an evidence-based program, but the way we are standing up our study, we hope that it will be evidence-based and we can get additional federal funding to support it. So that's one strategy. The second is that we are standing up what's called Care Portal, which is a national provider of just those economic supports that families need. They work across the country with local community-based organizations and churches. So if a family comes to the attention of child welfare and they need a washing machine, they put it into the Care Portal. A local community organization will say, we can get the washing machine, get that for the family. What the state is doing is, in the first instance, that will be the charitable organization, but we feel that it is the work of the state. It's not just a charity. So we are going to put funds behind that. So any request, if the charity can't meet it, there will be state funds to support it so that no need goes unmet. In addition, I just wanted to also just mention the work that we're doing around the mandated reporter training, because the front door, and I have to really thank Assemblyman Hevesi for his advocacy and support around this. Our front door is the State Central Register. Mandated reporters, community-based neighbors, friends call the SCR because they don't know where to find services for families. So what we did with our training is not only update the training, but make sure that we are infusing work around implicit bias, trauma, and ACEs, so that people understand why you're calling child welfare, that you're checking your bias, to your point around the high rates of disparity. And if you really need are looking for supports for a family, that's not what the State Central Register is for. We've also stood up a parent support line called the HERES line, and that's a place where we can get support for families as well. So we are keeping those data points and understanding that our system has ballooned into something it should not be, and want to make sure we are getting families the help they need, and the families that need this intervention of child protective services and foster care are getting that help.
Thank you. Assemblyman Hevesi?
Yep, I'm happy to jump in. So thank you. A couple of thoughts. So first, if you're looking to reduce poverty in New York State, you don't have to reinvent the wheel. We were very successful over the last couple of years when we had enhanced federal tax credits, the earned income tax credit, and Senator Brisport mentioned the child tax credit. So we have a proposal. We believe we'll get into to at least one of the or two of the one House budgets this year to combine those two, and they basically take the best of both. But the thing that I'm most excited about is that the child tax credit would cover those children who are age 0 to 4, which it currently does not do. I think that's hugely important. So if you want to replicate the success, and we saw something like a 20% drop in poverty in New York State over the last couple of years, those federal tax credits have subsided. They are done, and I don't see the federal government coming together to do them again. So it's now on top of the state. It's the state's responsibility. So I would start there. Also, the senator is right. There's proposals for housing. There's proposals for enhanced wages for almost all of our workforces that have been significantly underpaid for the last couple of years, last decade or two. And then finally, we have a new proposal, which I think gets directly to the question, called the Child and Family Wellbeing Fund. That fund is specifically designed to get money into the pockets of family and children who are in neighborhoods that have high child welfare involvement. Because the deputy commissioner is absolutely right. The high number of cases that are come into the SCR as neglect cases, but they're not neglect cases, they're poverty cases. So we have to rethink how we deal with this in New York State. And instead of coming in for a family that is in trouble or reaching out for help and providing services, right now they're much more likely to get caught up in the child welfare system, which is not good for the family or the child. So yeah, we're looking at another number of different modalities to get money to those families to prevent them getting caught up in the child welfare system.
Thank you.
I just wanted to add quickly that our governor has also set forth a task for all of her administration to reduce child poverty across the state. So there's a task force, and all of our agencies are participating in this effort. So that it's a key part of this administration's goals.
Thank you. Nancy, will you want to unmute and ask your question?
Sure, thank you again. As some of you guys already know, my name is Nancy Fortunato. I am an impacted parent and a DV survivor living in some of the undeserved parts of New York City. As a DV survivor who has struggled with poverty and has been impacted by the child welfare system, I understand the harms and the trauma that happens when these systems come in contact with families. They don't really understand what it feels like to be a DV survivor. Trust doesn't come easy for us. When parents get that first knock on the door, child protective workers sometimes come with the police, and their demeanor can be similar to an abusive partner, I'm sorry. They scrutinize, doesn't tell us what our rights, and blame or shame us for even being in that relationship. And it makes you feel like you're a bad parent. They exert control over you. It's re-traumatizing, terrifying, and undermines whatever good intentions you have or think you're offering to help those parents or help even DV survivors in general. It feels like you're going from one harmful relationship into another. That level of treatment creates more stress and the feeling of powerlessness. The main thing I want you to hear when I say it's like we living in fear all over again. How can we accept help from a system that we don't trust and terrifies our families by making us feel less than human and has the power to remove our children in a blink of an eye? That is what's being asked for many families in the child welfare system. Instead of going through systems, we rather seek support and empathy from people we trust in our community, people and organizations who look like us, understand us, and have been in our shoes. We need supporters, not reporters. That is why we like to see the community investment doesn't flow through systems and doesn't come with conditions like surveillancing, policing, removing, or coercion. Our communities are already working to promote the child family well-being, but the state funding is complicated to access. And too often those who doing the work aren't getting the resources to meet the need and empower neighborhoods to work together to address the root problems that have historically disenfranchised many communities. So my question for you, what funding strategies do you support to empower communities to lead and decide what is best for families and young people in their communities so they could thrive, not just survive? Will you support solutions like the Child and Family Wellbeing Fund?
I may hop in first. Nancy, thank you so much for your question. Again, thank you also for your vulnerability and sharing your story with us, because it is through sharing that that allows other families to come forward and be strong. I want to again uplift what the Assembly member mentioned earlier about the Children and Families Reinvestment Act, the fund, Nancy, which we absolutely support. And then in terms of dealing with CPS, two bills I want to uplift to empower parents and also reduce the number of calls that go into, or unsubstantiated ones that go into the SCR. One bill that the Assembly member and I share is we refer to it colloquially as anonymous reporting. So it would basically say that people who call in to report on parents will have to leave some sort of identifying information. It's sealed off. They know that it doesn't go into the record anywhere, but it cannot be totally anonymous anymore. They have to have it share that. And then a second bill I carry, we refer to colloquially as the Miranda bill. So similar to when a police officer will read somebody's rights, we've all heard the phrases, you have the right to remain silent, yada, yada, yada. This would require CPS workers to do a similar thing at the door, letting parents know about some of the rights they have, for example, the right to a court order before entering, things like that, in order to help reduce some of the racial disparities that we see interacting with the with CPS and services like that, due to some families knowing what their rights are and some not knowing what their rights are.
Okay, can I jump in and follow up? Okay, so first, I'm just going to repeat the senator's answer because he's right on the money. First, the children, Nancy, thank you for sharing your story. You were absolutely right. The Children and Families Wellbeing Fund is specifically designed to get money into communities outside of the ACS or the CPS system. That's its purpose. That's how we came up with it. So we'll be pushing for that this year. The anonymous reporting bill, I think the senator is absolutely right. We're going to have to tweak a little bit on that one. It's a work in progress, but we are trying to target harassing phone calls because we understand the way the law is written that right now, if somebody calls the SCR, automatically that investigation has to happen by law, therefore involving the state in these families' lives. And sometimes it's absolutely inappropriate for them to be doing that. So we're going to try to get down that number of harassing calls. And then I will tell you, Senator, that the last bill that you mentioned, the Miranda rights bill that you mentioned, I had hesitated about supporting that bill for a while until I had a conversation about a week or two ago, and I will be sponsoring that bill as well. It's Latrice Walker's bill, and also going to be pushing that bill gets moved, not on a committee agenda this week, we're having one tomorrow, but in our next round, so this coming month. So the senator hit them all right on the head. Those are really important pieces of legislation. So I thank you for bringing those up.
So I just wanted to echo a few things, and where I wanted to start with is that language does matter, and we believe in making sure that parents, as I say, parents, youth, foster care providers, everyone knows their rights. I worry about calling something, as we start with, we want to move from this concept of policing and to call the bill, that's where a parent's bill of rights, but to call it Miranda, which is also going to automatically take you to law enforcement, which we are not. And we are working really hard to make sure that our system understands that we are not law enforcement, that we are first and foremost a family support system. Parents should know their rights, our youth should know their rights, everyone within the system should know their rights, and we are absolutely behind that. But I ask you all to really think about language because it does matter. I wanted to also talk about the calls versus a report. Every call that comes to the SCR does not become a report. A report has to be investigated. So there's a big difference. And the Office of Children and Family Services working really hard with counties to make sure that we're seeing a significant reduction in harassing calls. We have the policy to tape recordings. We will work with the county to make sure that they go to law enforcement. We're encouraging DAs to also bring cases again, because we too do not want our system, which is a meaningful system, not to be used to harass families. So we are completely aligned with you, but I just ask that you all get information from us and data from us and help us to help so that we can help you craft something that actually achieves the goal that we are all seeking. And I would finally say, Nancy, to the point of the seats that you, Daphne, and Jessica are occupying as part of OCFS itself, it is important to, everyone talks about incorporating family voice, but we have taken the step to say that you are part of the design of the structure, the regulatory, the statutory framework, the policies, how we push out state, federal money, having you all work with us as part of the oversight as well. If counties are not doing what they should be doing, that is how we get to the change that we want. And we felt it was very important. We have our parent advisory board that sits outside of us, but to make sure that that voice is part of everything we do, is how we get to building the system and getting to the transformation that we speak of. It's not just words for us, it is action, and having you right here at every table, at every panel, at every seat with us, drafting and crafting this new system is important.
Thank you. Lisa, I believe you're next with your question.
Hi, my name is Lisa Winters. I'm a parent who's been impacted by the child welfare system, and I spent many years struggling with alcohol addiction Approximately 7 years ago, I made a call to my mother begging for help, admitting that my struggle with alcohol was affecting my ability to be a parent, and I needed to do something about it. What actually occurred was that a CPS worker was present listening to my conversation. My son was immediately removed from my custody, and I was left feeling confused, lonely, and terrified. I had no idea what to do next. I continued to struggle with my addiction, searching for ways to battle it, and I had not been receiving any support or suggestions from anyone involved in my case. During this time, I also had another child. When my daughter was 3 months old, I was met by another CPS worker who was threatening to take her. I was told that she had heard all of the excuses before and that I would never get sober. I am sober, proud to say that I've been sober for 5.5 years, and I'm now currently working as an advocate with families who are involved in the CPS system. I provide support and connect them to resources to assist them in the goals they're trying to achieve, with the hopes that these families will not have to go through the difficulties I experienced and know that they are not alone. I am not a bad parent. I am a great mother who just needed the right support during my struggle finding recovery. I wish that the child welfare system better understood the culture of addiction, recovery, and had sympathy for those struggling instead of just seeing us as unfit parents. Parents love their children. Seeking treatment doesn't make that untrue, but the threat of snap judgment by caseworkers and even addiction professionals discourages parents from seeking help, delays the discovery journey, and traumatizes the child. My question is, how are OASIS and OCFS working together to address the intersectional link between substance use disorders and child welfare system involvement, including programming, training, and treatment? And what will the legislature do to ensure that laws that pass consider the needs of people with mental health and substance use disorders?
So why don't I start? I can speak about the partnership with OASIS and OCFS, and I really appreciate all, this opportunity to come and speak about the work we're doing and hear from all of you. I know this is not easy. First and foremost, we as a system, and I speak about transformation, and it's important because there's the transformation is the recognition of the deficiencies and the acknowledgement that we have to change, and we are doing that work. We partner with intentionality with OASIS. We have monthly meetings with our partners at OASIS. We are learning ourselves. We all can look back to the 80s and the bad science, the lack of science, which led to the quote unquote crack epidemic and the significant removal of children and the ballooning of the child welfare system and the connection that substance use means. In many cases, that was the bad parenting. So that was then. We are in a space of all learning about harm reduction, about what it means to support a parent, and recognizing that substance use does not mean that you can't parent, but you parent with supports, and making sure those right supports are available. So this space is, as I said, it's a recognition of where we were. What happens when your work is rooted in a lack of clear science and misinformation. So the clear partnership, we're going to be doing a number of WebExes, trainings, for our system with our partners at OASIS, and making sure that the preventive services, the supportive services that parents need so that they can be wrapped around and supported. Some parents do need the intervention of foster care, but not all do. And that is the recognition that we have. And we have to make sure that there are real, robust, meaningful, accessible, culturally responsive services in every community so that families are getting what they need and the support to parent. And that's the work that we're doing with OASIS.
Senator, you're muted, or Assemblyman, you're muted.
Sorry, it was the most brilliant thing I just said. I do that every time. So I just want to thank the Deputy Commissioner. She's absolutely right. And Lisa, thank you for sharing. That's really brave, and I appreciate it. So I believe, I'm of the opinion that New York State is too quick to go to the ultimate exercise of their power, which is separating families. And I think it happens under certain circumstances that it doesn't have to, including for parents who are suffering with alcohol or substance abuse issues. And I think part of the problem with that dynamic is that New York State has not had for the last 10 years a viable system of mental health treatment and also substance abuse. It's just like everything else in the last decade from the last administration. They cut funding every year. It was an intentional cut, automatic austerity, which means that this year, in this year's budget, and I thank Governor Hochul and the Deputy Commissioner, they're putting lots of money, billions of dollars, $1 billion, I believe, is the proposal, broken down into a variety of different things, including inpatient beds, outpatient beds, teams at emergency rooms. So there was a real recognition that there weren't mental health services available appropriately over the last decade. Substance abuse as well. It's another issue where we were underfunded for a long time. So we're going to have to get that money back into the budget. So I want to thank the Hochul administration for putting their foot forward, recognizing that that's a significant problem and putting money behind it in this budget. We are now at the stage where we're going to, I don't want to speak out of turn because we haven't brought our one house proposal public, but we're going to accept the governor's recommendations on how much money to spend on those type of services. We're just figuring out if we agree where to serve it. But historically, that's the reason why many parents are not able to get the supports that they need, which would either obviate the need for them getting involved in the child welfare system or having their kids taken away from them. So we have a lot more work to do, and I want to thank the governor for leading on this front. This is a very important issue. And Lisa, thank you again for sharing.
Thank you. So Jessica, I believe you have a question.
Hello, my name is Jessica Cooper and I live in New York City. I'm a mother impacted by the child welfare system and now serve as a family policy advisor with OCFS and Families Together. In my previous role, I worked in a voluntary foster care agency as a parent advocate trying to help families reunify. My first time there, was illuminating. I can say I have been on both sides and I see what I see is not pretty. People in the system often do not understand the communities they serve and judge people as if there's only one way to raise children. Family culture is different from family to family, but is often not respected. School and healthcare systems often report as a default rather than support them. In order to get their children back, families often get mandated to acquire community services for mental health, addiction, and developmental disabilities that weren't available for accessibility in the first place due to workforce shortages and waiting lists. And so families seeking to reunify are often asked the impossible, and if they fail, they are deemed unfit parents. And so the system meant to help is actually crushing families and eroding their spirits. But what we often ignore and minimize is that despite whatever neglected and unsafe conditions workers use to justify separating a child from their parents, the act of removing the child and severing that bond is the deepest trauma a child could endure. That's what they will remember to the core for the rest of their lives. And so my question to you all is, what is New York State doing to truly support families seeking reunification instead of judging them? And what will it do to ensure that the dignity and culture of families is honored and respected?
I should probably start. Thank you, Jessica. I think it's important for us to say that yes to I hear everything that you're saying. And this is as a system where we are moving. The recognition about the high number of children, the high rates of disparity within child welfare, the recognition that the driver of poverty-related issues is what brings families to our attention. The lack of meaningful supports and services in community, the lack of culturally responsive services across the state are factors. So when you say, what are we doing as a state? I'll give you one example, and because you brought up the educational system. We at OCFS partnered with the State Department of Education. We took funds that OCFS had and State Ed had and combined them and put out requests for proposals. We looked at the family resource model and the community school model and created what we call family opportunity centers. For us, we know that education, healthcare, and law enforcement are the greatest drivers of attention to the state central register. And a lot of, this is where families with young children are, in the school buildings. So this had not been done, combining funds from different entities and saying together that we know where we need to target to reduce the unnecessary intervention of child welfare, but to make sure families are getting what they need. So this pilot is really to make sure that those resources and supports are where families are. It's a small pilot, a number of, I can get the exact numbers of where we are across the state, but it's not only for resources that will be in these opportunity centers, concrete supports. We have Office of Mental Health also looking to push in mental health supports as well within the resource centers, and also partnering with OASIS as well for substance use support. For us, this model, this pilot is, if it goes well, this becomes the hub, which we know can be a central place. And it doesn't have to be in a school. Community-based organizations are also welcome. But we wanted to start with schools because we know that's where families are, and that's where the needs are often first identified. So this is a way of taking our money, putting it out, further upstream, in schools before anyone calls the state central register, identify the supports, and then bringing our other sister state agencies to the table to say mental health, OASIS, domestic violence providers as well, come here, here's a place to provide supports to families. The other thing we launched are mobile response vans with a number of counties across the state. We had some additional funds from the Office of Victim Services. And these mobile vans are in Albany, Monroe, Westchester County, and I'm forgetting the other county, I'm sorry, but they're huge Winnebago vans that we are putting supports and some services, and they're over the summer, they're all going to have support groups as well. Again, moving those concrete and economic supports and also services out to where families are well before. Our goal is to reduce those numbers of unnecessary calls to the state central register. So we see where we have fallen short and where families have been harmed, and are making every effort to think of our strategies and our funding, using it in a way to help families before anyone calls the state central register.
Yeah. And Jessica, I'm going to follow up with the Deputy Commissioner. She's right on the money. So for me, and thank you for your question, because one thing really jumped out at me, your question, which is the impact of trauma. And not just the trauma of family separation, but also the threat of family separation, and how that is a hugely impactful problem for our kids. So we're looking through, and we've mentioned a bunch of them on in this forum, a variety of ways to make sure that people don't get involved in the system in the first place. One, the tax credits, earned income tax credits, so people have money in their pockets, whether that's the earned income or the child tax credit. Also, the Child and Family Wellbeing Fund, because we recognize that a lot of these cases are poverty related, so we want to get funds directly into those communities as a primary preventive measure before they get involved in the system. And then the last thing is a real recognition of just how dangerous and how impactful that kind of family separation is to these kids. It's life altering for many of them. And we need to make sure that the state is doing that as judiciously as possible. And that means a variety of things. That means cracking down, like the deputy commissioner and the senator said, on anti-harassing phone calls. We need to make sure that the families have the ability to navigate that system, even though it was an incredibly difficult system. And maybe we need to look and reevaluate our criteria for allowing families back together. So we're also going to be taking a look at the mandated reporter system in the next couple of months. There'll be a hearing on that in the Assembly. I'd invite all of you to participate so we get a sense of whether that system is a net positive or a net negative for the families that we're concerned about. So there's a lot of different things that we are looking at, but the general picture is, I think New York State, and it's starting to happen under the leadership of Governor Hochul, and also I would say Assembly Speaker Carl Heastie and the Senate Majority Leader, that the traumatizing of kids is the cause of almost all of our societal problems. If you look at the newspaper and you see all of these terrible things happening, it's a constant bad things on the news. I believe that it's all stems from a rampant childhood trauma. So we're going to be looking at a variety of things to try to make sure to prevent as much trauma as possible, or in the worst case, if those kids are traumatized and family separation is appropriate, and we want to minimize when that happens, but to hopefully reunify those families as quickly as possible, if that's a possibility. So we're looking at a variety of things, but I thank you for bringing up the crucially important point of trauma and adverse childhood experiences for our kids. That is the real enemy for us, and we got to work together to fight it. So thank you for the question.
Thank you both. Brad, did you have a question or a comment before we close out today?
Yes, and I'll just piggyback a little bit off the Assemblyman, that so much of the, like you're saying, so much of the trauma that young people are going through, we, I think, have in the past looked at families and parents and tried to assign blame, and in reality, we know, and the data backs up, that there are systemic traumas that we as a society need to be thinking about and addressing well before we ever get to the place of saying a parent did a bad job raising their child, when in the reality, the context in which they're operating in is very in itself traumatizing, and they're experiencing toxic stress and all these things that are making it hard for them to be the best parents they can be. And so let's not judge them when the fishbowl is the problem, right? I want to uplift something, and this may be more focused on Deputy Commissioner, but we have family policy advisors now, 11 across the state, and we're bringing family voice into the oversight in OCFS. But I'm wondering, what is the next step in terms of bringing family voice to programs, bringing family voice to counties, and really building up the family and youth peer support workforce and presence in every place that is interacting with families. Like, and I know you probably have some thoughts on that, but I know there's people in the audience wondering that same question, like what's next? So maybe you can share your vision with us.
So thank you. We started with the family policy advisors because we wanted to make sure that we had a strong foundation. Again, starting with an advisory board and now moving into the office, we wanted to make sure that the work is meaningful, that we are supportive, that we understand, that this can be triggering for families who have been impacted by the system to sit around, these tables and read hear the conversation. We have to learn, as I said, about language mattering, understand within our system as well, how we speak, how we frame discussions, understanding that every piece of paper that we draft, or every keystroke, there's a family behind that. So there's a lot of work to deepen the support around the family policy advisors. And we think it's going to take a few years for us to be strong. And the long-term goal is that our family policy advisors, excuse me, I said peer, our family policy advisors will be the leaders, because the goal is to then have within counties, family advocates, family policy advisors as well. So we're starting with ourselves, getting strong and solid, and then this team will help move this work across the county, the state, in the counties. And to be sure, there are many counties that already have advocates who are part of their system, but we think that there's more that can be done to deepen and strengthen the work. The work that we're doing, as I mentioned, about the Brave Hearts to stand up the youth support line, which will be, we're making sure that youth who are currently in foster care or age out of foster care are the individuals working on the line. That is intentional as well. And we want to make sure that as we build up that line, there's enough support around that group as well. And that eventually that will also become a state employment opportunity. So we see this as not just a new thing, but we're going to slowly and with intentionality build a strong team that will be part of standard practice for our state workforce.
Deputy Commissioner and Assemblyman, I just want to say thank you so much again for a wonderful conversation. It's so wonderful to watch the dialogue between you, because we're not usually privy to that. And we get to see, we're like coordinating systems for you. We're helping you guys have open dialogue and doing it in response to families and young people telling their story and asking really poignant questions. I love these town halls for that reason. And this one is especially important because we have such great allies in the state agency and in the legislature. So again, I just want to say thank you for your candidness and for your transparency and your progressive thinking about this system and about how families and young people can be involved. Thank you so much.
Thank you. Thank you.
Thank you.
Thank you for the opportunity. Thank you.